We are now on Module H, discussing the cardiovascular system. Our cardiovascular system, of course, is also called our circulatory system, and it's the continuous movement of blood throughout our body. There are some changes that do happen as we age. Our heart muscle becomes less efficient, our blood pumps with less force, and our arteries lose elasticity and become more narrow. All of these factors cause us to have increased blood pressure as we age. Some variations from the normal that you want to make sure you're reporting right away: shortness of breath, changes in or difficulty breathing. If you notice changes in your patient or resident's pulse rate or rhythm, the loss of ability to perform activities of daily living, chest pain, swelling of the hands or feet, pale or bluish lips, hands, or feet, which are showing that we're not having good oxygenation oxygenation to the periphery, weakness, tiredness, or weight gain. And now we're going to talk about a couple of conditions of the cardiovascular system that are pretty common that you're going to likely to come across. The number one being high blood pressure, also known as hypertension. The major cause of high blood pressure is atherosclerosis, or what you may have heard referred to as hardening of the arteries. So as we age, our arteries harden due to buildup, like plaque buildup from fatty deposits. People with high blood pressure may complain of things like headache, blurred vision, and dizziness. So if you have a resident or a patient who is reporting any of those, make sure to report that right away so that the nurse can come assess, and you can also help by getting a blood pressure. Coronary artery disease, you'll see it abbreviated CAD. This is a condition in which blood vessels in the coronary arteries narrow. And again, when we say coronary, we're referring to our heart. So our coronary arteries are the vessels that feed our heart oxygen and blood. So when the coronary arteries narrow, it lowers the blood supply to the heart and deprives it of the oxygen that it needs. With time, fatty deposits block arteries, which can result in a myocardial infarction. So again, you can have some narrowing of the arteries with these plaques, but eventually they can close off completely, resulting in, like I said, myocardial infarction, which you may have also heard an MI or heart attack. Another place that this can affect, if you have an artery that's blocked, that's one of the arteries that heads up to the brain, this is when we have a stroke. You may have heard of angina or angina pectoris. This occurs when the heart muscle is not getting enough oxygen. So this can be caused by more strenuous exercise, stress, excitement, digesting a big meal, because all of these things require more oxygen. So a heart that has coronary artery disease and narrowed vessels, it's going to make it even harder for the heart to get that oxygen that it needs. So our heart's already having a hard time getting the oxygen it needs because of coronary artery disease. And then you add in exercise, the stress, the excitement, etc., which requires more oxygen. So now we're really depriving the heart, and that's where we get that pain. So these patients or these people may complain of chest pain, pressure or tightness of the chest, pain that radiates up the jaw and or down the left arm, and you may see these folks looking really sweaty or diaphoretic and short of breath. A myocardial infarction or a heart attack is, of course, an emergency situation. This is when all or part of the blood flow to the heart muscle is blocked, and any oxygen and nutrients that those heart cells need cannot get there. And on top of that, the waste products that those cells are trying to get rid of are not being able to be removed from those cells in the heart. And that causes the muscle cells to die. So when someone's having an MI or a heart attack, it may affect a small or large area depending on which artery is involved. If a resident survives a heart attack, they're going to need to do cardiac rehabilitation. You may come across peripheral vascular disease. You'll also see that abbreviated PVD. This is poor circulation to the legs, feet, arms, and hands, again, due to fatty deposits that harden in the blood vessels. Signs that this may be an issue for your resident: the nail beds and feet may be pale or blue. You may see swelling in the hands or feet, ulcers of the legs or feet, and it can be very painful when walking. I'm sure most of you have heard of congestive heart failure, or CHF. This is when one or both sides of the heart stops pumping blood effectively. So all of the conditions that we just discussed, right? High blood pressure, coronary artery disease, MI, peripheral vascular disease, these conditions can lead to severe damage to the heart muscle, resulting in the heart not being able to do its job, again, effectively and efficiently. If we have left side, now, real quick before I said, once you get more comfortable and familiar, and if you look at an image of the flow of blood through the heart and the body, it will make sense when I say these next two points. If you have damage to the left side of the heart, it causes blood to back up into the lungs. If you have damage to the right side of the heart, it's going to cause blood to back up into the legs, feet, or abdomen. If we have more blood backing up into the lungs, we're going to see more shortness of breath, coughing. If we see blood backing up into the legs, feet, and abdomen, we're going to see more swelling or edema. These residents may also feel tired, weak, and dizzy. They may have irregular or rapid heartbeats, feel short of breath or swelling. A lot of times these patients are going to have increased urination throughout the night and weight gain because of that excess fluid and the inability to circulate that fluid and excrete, pull out waste and extra fluid and excrete them. Our role when someone has congestive heart failure is assist them as needed. If they have to go to the bathroom multiple times a night, help them. Respond to those call bells promptly. Give them adequate rest periods. For our residents with both cardiovascular and respiratory issues, rest periods are going to be really important, and pacing our care based on the resident's pace, not our own. We want to measure adequate and accurate intake and output. If the compression hose are ordered, we want to make sure that we do those per order. Elevate head to bed. Weigh resident as ordered by the doctor, could be daily, weekly, and help them to perform range of motion exercises and encourage range of motion. In general, for the cardiovascular system, we want to make sure that we follow the plan of care, monitor vital signs, and report any abnormal values right away, right? Don't wait till the end of the shift or after you're done with everybody. If you see an abnormal value, report it. We want to assist and encourage special diet needs. A lot of times our patients who have cardiovascular disease are going to be on low sodium diets or low fat diets or both. We want to provide those rest periods at intervals like we talked about, measure intake and output accurately, and prevent the resident from getting overly tired or needing that extra oxygen, right? So these rest areas and not getting them too tired all at once doesn't deprive their body of the oxygen that they're already lacking. We want to report complaints of chest pain immediately to the nurse. If they are complaining of chest pain, we also don't want to leave our resident, right? Use the call bell in the room, call for help, and stay with the resident. Avoiding extremes in temperature, especially cold, can be helpful in reducing these stressful situations. And another time we want to be aware of this is if our resident or patient has visitors, family, or friends coming, how do they respond? How do they behave after that those family members or friends have left? Has it been a stressful event or a pleasant one? And a lot of the rest of the cardiovascular system we touched on in the module AA when we discussed the different vital signs. So that all kind of ties together with this system as well. And that concludes the cardiovascular system.